Firstly, just how worried are you about the Omicron variant from what we know so far?
So look, it's very early days and we really do not know at this stage what this new variant of concern will do. The cases so far have been mild, but they've also been in younger people generally in Africa. So that doesn't tell us whether this is a more serious variant in terms of more serious disease and more serious outcomes. It does look like it's more transmissible, however, and that's a serious concern in terms of if we get a lot of cases, that means we'll certainly have more hospitalisations and deaths in that situation. So look, it's very early, we just don't know. The mutation number though, and the site of the mutations is of concern, and that's why the World Health Organization has called this so early as a variant of concern.
I see here in Australia, our peak vaccine advisory body is now re-looking at the booster program here. I've seen some experts suggesting that a booster shot could actually be worth getting as soon as 2 months after the second dose. What is the data telling us about just how quickly efficacy fades?
So we know efficacy fades to some extent at about 2 months and then continues to drop, and certainly by 6 months there's a reasonably large drop. And the main issue with this is transmitting the virus. You're still protected with Delta from hospitalisation and death largely, even at 6 months. But we don't know about this new variant of concern. We just do not know. So the sensible approach, one could argue, is to get the booster earlier so there's a much larger population with recent high levels of antibody. It's almost, or very likely, current vaccines will provide some protection against Omicron. We just don't know how much. But even if it's only partial, recency of vaccination and boosters will certainly add a layer of protection. So the UK, for example, has gone for the 2-month recommendation. One could argue to go longer, but I think, bringing it forward would probably be sensible.
What about the type of vaccine people have received? I know you keep saying it is early days, but are the experts at one as to whether or not, you might have better efficacy against this new strain if you've had the AstraZeneca versus the Pfizer versus Moderna?
I wish I knew. It's a really good question. There are test tube studies going on right now. We'll know in a couple of weeks, hopefully, about current vaccines and their protection in terms of the new strain. So we'll just have to wait and see. I'm hoping that, in fact, there's little to no immune escape, and that means current vaccines will work very well. That would be the best news we could have, but we'll have to wait and see. And obviously, it may be also vaccine dependent. It's possible certain vaccines may be better than others. It just depends, again, on how the virus interacts with human host cells in terms of the outcome.
Professor, are you confident that this latest strain will give governments right around the world a bit of a kick up the pants in terms of vaccinating our poorer countries around the world? Is this sort of what we might have needed in terms of getting on with that program?
I'm not sure I'd use the word needed, but I certainly think it's going to give them a kick. There's no doubt we need to push very hard to vaccinate the world because we're all still at risk as long as there are large numbers of cases anywhere in the world. And of course, if we let large numbers of cases also occur in Australia, I mean very large numbers, that would also mean we'd be at risk of a variant arising here in Australia directly. So keeping those numbers as low as we can, relatively, and working to protect the population as much as possible until most people are vaccinated, that would be the ideal outcome if we can achieve it.
Professor Nick Talley, I appreciate your time. Thank you.
Thank you.